This is a demonstration of Allscripts Professional EHR for nephrology. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In nephrology practices, most providers are challenged with quick and easy access to lab results, referring provider notes, message triage, quick access to patient charts, and too much time spent documenting visits. Allscripts Professional EHR can help make your life a lot easier with result notification, encounter packs for easy referral letter generation, messaging, the face sheet for quick access to patient charts, and template use for ease of documentation. Now let's take a look at how Allscripts Professional EHR can help meet your needs. You're logged in as Cindy Pope, who is the nurse for today's scenario. Cindy is reviewing the schedule for today. She can see exactly which patients are scheduled and why they are coming in. The patients' names appearing in black indicate patients that have not yet checked in for their appointment. If their name appears in blue, that simply means the patient has checked in and they're sitting in the waiting room. If their name appears in green, the patient's chart has been started by the nurse. If their name displays in red, the patient has checked out. Your patient for today's visit is Daisy Dillard, who is here for proteinuria. When you select her record, an alert is displayed telling you to get a smoking assessment for this patient and check to see how she's doing with the self-monitoring of her blood pressure. Immediately, her results are displayed here for the doctor to review and sign off on. As a nurse, you may want to quickly check her face sheet to see if there is any other information you need to be aware of prior to moving forward and documenting her visit. You can quickly review her face sheet, which shows you her entire chart, including her problem list, her meds list, her allergies and procedures and surgeries, her encounters, including office visits, consults and messages, her current meds list, and any orders that have been placed in the patient's chart. If you expand the window to the left, you can see exactly where you will be going to document this encounter. The first place you'll go is her vitals. You've seen this patient before, so you can use her previous vitals, and it pulls in her height and weight. If she's gained any weight, you can document that very quickly and also update her blood pressure. Once you've documented that in her record, it displays for you here, showing a trend in her height, weight, and blood pressure, as well as automatically calculating her body mass index, which is a meaningful use requirement. Her history has already been documented from previous visits, and this stays in her record. To pull forward that information, you simply select Include Active, and that pulls her active history into today's encounter. As you can see here, it shows her complete history including her allergies, her meds list, etc. You go and update her allergy list. The patient is telling you that she is allergic to peanuts. She ate peanuts the other day and noticed that she broke out into a rash immediately thereafter. Now you just updated her allergies list. Penicillin was already there, sulfa drugs, and now peanuts. The medication list shows you her current meds, which you can include by selecting the Include Current button, and also her fill history, which shows you all the medications that have been previously prescribed to this patient, which she had filled using her insurance. That means there's a record of all her prescribed drugs that can be pulled into her current encounter. Once that has been pulled in, you can reconcile that list and indicate that the medications list has been reconciled, which is a meaningful use requirement. Her social history can be updated to indicate whether or not she is a smoker. She is not a smoker. She is only exposed to smoking. Here's an example of the note so far. The last thing you enter is why she's here today. Here is the list of choices in her template. Again, you indicate that she is here for proteinuria, and her symptoms include a little fatigue. No fever, however. She also does not have any flank pain. And this has been going on for the past 6 months. At this point, you're going to send the chart to her doctor's inbox. This goes right into Dr. Kidd's inbox, who will then see that the patient is in exam room 6. The nurse will put a sticky note on the chart indicating the patient is tired of waiting. Now you're logged in as Dr. Kidd. He sees the same schedule that the nurse sees. But over here to the far right, he'll notice his inbox or his queues. The queues show him all the work that needs to be taken care of for the day. His received chart shows him where all the patients have been roomed. So Daisy Dillard is in exam room 6. And the nurse also put a sticky note on the chart indicating that the patient is tired of waiting. The doctor sees this immediately. The nurse has already completed the smoking assessment, and you'll also make sure you talk to the patient about monitoring her blood pressure. Immediately, the doctor can see any lab results that are back for this patient that need his review and signature. He can review her renal function panel immediately and sign off and publish those to the web if he wanted to send her results through the portal. The doctor can also trend the new lab results and put them on a graph if necessary. At this point, the doctor is going to walk into the exam room and begin talking to the patient to get any additional information regarding the problem. The patient indicates it's getting worse. Associated symptoms don't include abdominal pain or urinary retention and no headache. If there's anything else you need to add to this, you can certainly add that right away. If there are any other conditions this patient has, you can add that as well. If they don't, you want to indicate that they do not. As you select your choices here, it updates and creates the note for you. Are there any other disease complications? The patient does have hypertension and edema. Next, you'll jump to the review of systems. You import a previous visit for this patient for the same problem. When you select Apply, that actually pulls in the previous visit's documentation. If there are any changes, you can make those changes here. There are no changes at this point. However, to quickly make a change, you can go right into the note and document any findings and mark them red if they stand out. In the physical exam, the same rule applies. You can pull in a previous office visit, select it, and apply it to today's visit. Here is that note. The last time you saw her, she had only edema on her lower left extremity. But today, she has edema on the right as well. You'll mark it red so that it displays. And now you can see that note. In the assessment and plan, the previous visit displays here what the ICD-9 code was along with the last office visit and what the treatment plan was. This is the protocol that was used by the doctor the last visit. In this case, the doctor wants you to use the same protocol, order another renal function panel and a urinalysis. You'll select that, and it will drop right into today's current plan. Once that's documented, all the orders for the labs have been placed and the patient is to follow up in 1 month. Now you can view that final note, the patient's demographic information, the actual visit documented by the nurse, as well as the provider. If the provider has completed this visit, he can run the E&M calculator, which will indicate at what level of service this visit should be billed. So this is a previous problem that seems to be getting worse. You calculate the visit. This shows a 99213. The summary sheet gives you the reason why this is a 99213. In order to achieve a higher level, you have to document at least 4 HPIs or give 3 chronic conditions. You can certainly go back, document more information, make sure you didn't miss anything, and recalculate the visit. You'll accept the code as is and sign off on the visit. The super bill displays here telling you the level of service that was selected, along with the ICD-9 code and any billing codes for lab results. The encounter pack displays the referral letter back to the referring doctor and a clinical summary, which is required for meaningful use. At the time you select to finish and sign off on that note, those 2 documents will generate immediately. The consult letter back to the referring doctor displays here with the doctor's name already pulled into the letter, along with the documentation for your note. The progress note is embedded into the letter, with the assessment and plan and the doctor's signature already in place. If you want to edit this letter, you can certainly do that on the fly and remove that she is not a pleasant individual. Immediately the change has been made. The clinical summary, which is a meaningful use requirement, is a template that's already a part of Allscripts Professional EHR, so it's already built in. The information is automatically pulled in from the progress note on the patient's chart and pulled immediately into the clinical summary, which can then be printed out for the patient at the time of checkout. Once you've signed off on the note, the chart is filed immediately and brings you right back to the scheduler. Over to the right in the queues, the provider can easily access messages, results that have come back, etc. When you were in Daisy Dillard's chart, you were able to quickly see her lab results. If you want to see results for all patients in your result notification window, you select it, and it shows you all the results that are back for all of your patients. Those indicated in red are abnormal, and those that are not are normal lab results. You select the results for a patient, quickly review it, and publish it to the portal to the patient. And it's that simple to sign off. Inter-office communication can be done very easily with the messaging feature. For example, A message has been sent to Dr. Kidd's inbox regarding a patient who called about protein in his urine, or if another patient is acutely ill. You'll open up the message that's come over to you from the nurse. You could review what was actually entered in by the nurse or sent from the patient through the portal. You can easily reply and respond back to the patient. In this case, this is a web message telling the patient to please call the office. You send that back to the patient and save it to their chart. The same rule applies if it's just a general message that's come over, but it will look slightly different. The report results allow a practice to run reports for meaningful use requirements which are already a part of Allscripts Professional EHR, as well as any other types of reporting necessary for the practice. If the patient wants to run a meaningful use report to see how all the providers are doing for writing prescriptions electronically, a report is automatically generated and can be put on a schedule. For example, every Monday at 9 a.m., the administrator wants to see how well his or her physicians are doing with e-prescribing. As you can see, the percentages are listed on the right for each provider. Other reports are available as well. For example, all your patients that have chronic kidney disease that have not had a Hep B test. You have one patient that shows up meeting that criteria, and you can actually notify the patient by phone, through the web, or by sending out a letter. You can very quickly do a mail merge or call that patient. When you select the result list, that actually gives you the phone number of the patient where you can easily call the patient and document in their chart that they have been notified. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts Practice Management Solution seamlessly, the Allscripts Referral Network, to patients through the patient portal, to patient charts remotely with our Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.